Come back with me to 1981. I am a captain in the Air Force, and I've just completed my residency, my one-year residency at Barksdale Air Force Base, and have now been assigned to Han Air Base, Germany. And it's no longer an active military base. It is sort of like a FedEx Airport. The facility was old, and it had some of the markings of the prior occupancy of the French. And it was, I was there at a time when there was a transition between the type of fighter planes that were stationed there. We were transitioning from F-4 Phantoms, which were two-seaters and kind of a large, bulky jet, very well known from the Vietnam era. And we were now coming into the General Dynamics F-16. This is a plane that could take off and go vertical, straight up, 10,000 feet in the air without leaving the end of the runway. In other words, it's like a rocket. It was an amazing thing. And it was the first one, and then there were other planes, jets, that have that capability. It's amazing to watch them. And the F-4 was just as loud as the F-16, as I recall, but they're pretty loud, both of them. And I'm a dentist there, and I'm working on active duty and civilian, because in Germany, you bring your family over, they get some access to the military, medical, and dental. And in fact, I had a daughter born in the hospital there. So, and I was good friends with all the physicians, because the base was small. So we had a small group of people, and we got along well. And remember that I was assigned to do periodontics. I'm a general dentist, but I've been taking over the role of a periodontist. And this means that I am beginning to treat hundreds and eventually probably thousands of patients before I leave there in about 4.5 years. And so the initial examination of each individual coming in begins to look familiar to me. In other words, the things that I have to do and say are repetitive. And it is in this environment that I actually developed what I call A Tooth Has Four Parts. And if you want to see that talk, A Tooth Has Four Parts is on my website. Just look for it on the homepage. It says A Tooth Has Four Parts. The reason I named it that was eventually I became an instructor when I was lieutenant colonel. At the very end of my career, I was the head of essentially the dental hygiene program for active duty military. It was called the Periodontal Therapist course, and it was to train assistants to do periodontal therapy under a periodontist somewhere in the world. And they would come to Lackland Air Force Base here in San Antonio, Texas, to the Dunn Dental Clinic on the training side of the facility of the base. And that's where our program was. And we would train them for about 6 weeks. And then they would be released back to their home bases. And then in a year, after having accomplished certain requirements of certification, they were given a certification that they had completed the whole course. So the course was in 2 parts, part of it with me and then part of it back with the others. And I used that A Tooth Has Four Parts as the training program for them, because it's the way you can always start the conversation. You don't have to try and figure out how to be clever and what to say. All you have to do is say, well, a tooth has 4 parts, and here they are. And then 3 of them. It's enamel, dentin, the pulp inside a tooth. Everybody knows about toothaches. But it's the fourth part of a tooth that nobody knows about because it's microscopic and it is surrounding the root in all directions. And it's given the name cementum because it cements or holds something, which are little tiny fibers which project out in all directions and attach that tooth to the bone and the gums. And so here I would be drawing a picture, and that picture would look like those old histology slides that I saw my first year in dental school. The cross section that shows the tooth and the fibers and the bone all there, and where things begin to break down and all the rest of it. So it was as a young captain that I had to, and everybody does, I'm sure. I mean, that's not unique to me by any means. You've got to come up with explanations as to what's going on so that patients can understand it. And it is important that that be accomplished. And I think it's more effective, frankly, to do it in a way that helps patients understand from you what's going on. Eventually, I was able to videotape it. That videotape is now a bit old. I probably should update it, but it's work, and there are a lot of other things that are important to do as well. So I'm not inclined immediately to go in and refreshen it, but I will eventually, probably. No plans at the moment. But anyway, the presentation, even if it's videotaped, it shows your face. I think that's more important than giving people a polished lecture by somebody else or program or anything else that explains things in very clinical terms that does not also convey this is what you believe, this is what you as a doctor think about it as well. So that kind of was part of my development that actually preceded my periodontics residency, where I actually studied that discipline at a much deeper level. I had already had a lot of experience in treating patients with periodontal disease. And a few times it freaked me out so much seeing somebody with severe disease. I'm a young captain, that I actually referred them to a larger base to be seen and by a periodontist. And the people there were wonderful. They would write me notes and encourage me and tell me what they thought I should do. And one of them actually turned out to be one of my instructors when we came back to the States. He was reassigned and became one of my instructors and a very good friend of mine. So that's the story of a tooth has four parts. It's out of that I really believe we can have a conversation that goes into the depths of specific areas that are now interesting and progressing. Because one of the things about a really good story or explanation of a disease process and the treatment therapeutics of it is that at its level, it's true. In other words, one of the things that bothered me in dental school was in pediatric dentistry of what to say to children about the injection. Because, you don't want to scare people. You don't want to say, oh, I'm going to give you a shot. So you don't want to use inflammatory language. But on the other side, if you're trying to do things in a way that is misdirecting, which is, I totally get it, and I in fact like it. In other words, why show anybody the needle? Why not do it in a way where they don't even see it, and that they can then experience what it feels like that's much less than what they expect, because there are rational reasons why it doesn't hurt as much to get an injection in your mouth as it does on your skin. And even that, I mean, really, honestly, I am an intramuscular injection in your deltoid, done well very quickly. You don't feel that much. I think what sometimes you feel is following the injection, whatever was injected can have a reaction, and that hurts, obviously, but that wasn't the shot that did it. That was what was in it that did it. Anyway, back to these kids in dental school. It was a I didn't like the idea that I would tell a child that I'm going to put drops on your tooth. I didn't like the idea that we were going to redirect them so much that it was misinformation. I'd rather not give them a lot of details, but I don't think that any of the details that I give them should be incorrect to the point where if they looked down and saw the needle after what I had just told them, they wouldn't just freak out. So what I learned to do or try to do is to be as honest as possible. Are you going to give me a shot? No, I'm not giving shots. I give something to make you numb, and it'll be gentle, and I'll do it very carefully for you. But I don't call it a shot because it's not that. So I would go into things like that as opposed to, well, I'm gonna drop sleepy juice on your tooth, and your tooth is gonna go to sleep for a little bit. So anyway, back to Perio. That's the same idea here. It's that we can describe things to a point that are true, and then after that, they aren't completely true. And that's where a tooth has 4 parts really helps me, because I felt at some point it was important for the patient to learn what cementum is. Anyway, that's it for today. Let's pick this up next time. Thanks.